Hi, this is Markeitha, and welcome back to Healthy Living. Okay, so you can reach me at markeitha.com. That's my main website. Also, you can reach me at healthyliving.company. At my website, you'll find several things. There's several products, like I have Keita's egg toast and gumbo. The gumbo comes with hot water cornbread and rice. So you have to send me a message, or you have to call me here at the Next Level Studios at 310 549 1113, 310 549 1113. Now, also, the producer of the show is T Jams. That's TJAMZ. You can reach him at tjamsmusic.com. There he has a whole list of songs you can write lyrics to. You can send him messages. You can also call him here at the Next Level Studios at 310 549 1113. 310 549 1113. Also, he does web designs. Okay, so now we're going to talk about the coronavirus updates. So I usually retrieve my information from the CDC website, which is the Center of Disease and Control. Also from the Cal OSHA website, mainly for employers, employees with the different standards. I receive my statistics from the Markeitha website for the coronavirus numbers and updates. So I also retrieve some of my information from the LA County website, the public health. So I get those numbers from LA County. Now, the Markeitha, as of today, the total number of reports of cases, this is across the world, 35 million. We're in the millions. I can't believe we're 35 million. 244,473. Now, deaths, we have passed a milestone of 1,039,000 with 498. That is absolutely terrible. There is 26,222,084 that have survived the coronavirus. But you have to protect yourself. We don't want people getting the coronavirus. The U.S. is the lead in the coronaviruses. We have cases. We have 7 million. Yes, 7,614,576. Deaths, we have 214,397. Now the second leader is India in cases. They have 6,573,678. They lead third in deaths with 101,997. Now, Brazil is third in cases, but they're second in deaths. So Brazil cases is 4,906,883, and their deaths, which is second next to the U.S., is 146,011. It's terrible. Per Maria Frelink, she was on Medscape. So as of August 18, 2020, the list of healthcare workers there across the world is incomplete. So we actually don't know what the numbers are. But per her website, there's 74 countries, 386 in the U.S., and the youngest is 21, and the oldest is 99. So these are the healthcare workers that she has. Now, the majority of the people with coronavirus have mild symptoms, such as cough, fever. However, there's more serious symptoms, like shortness of breath. You know, when you suddenly can't breathe, you feel like you can't breathe. Chills, repeated shakes with chills, muscle pain, headaches, sore throat. Also, loss of smell and taste. Loss of smell and taste. People tend to ignore that sign, but that is a sign. Now, as of March 11, the World Health Organization declared the coronavirus 19 a pandemic. A pandemic, meaning it's worldwide. It's everywhere. Okay? This virus was first reported in Wuhan city of China in 2019, and that's why it's called COVID-19. The spread to now it's like 214 different countries and territories in the world, 2 international locations. It's everywhere. What is the novel coronavirus? It's a SARS coronavirus 2. It's a severe acute respiratory syndrome, a virus with beta coronaviruses, different ones, 2. Also, there's the Mid-Eastern respiratory syndrome, which is also another coronavirus. all three originated from bats. Wow, and all three originated outbreaks came from Wuhan in 2019. At first, they said that it was animal to person because they have a lot of live markets, right? But then it started spreading, so then it became person to person. Hence, this is why we have the pandemic, because it went from China to outside areas of China and then across the United States. Now, illness range from anywhere from mild to death. It just depends. Everybody's a little bit different. Typical coronavirus causes mild to severe death. Symptoms are wide and ranging. It's not the same with every person. That's why it's so difficult to understand. But some of the symptoms include fever, cough, shortness of breath, fatigue, chills, repeated shakes, like I said earlier, with muscle pain, headache, sore throat, congestion, runny nose. You also have nausea. You can have diarrhea, vomiting, and loss of smell or taste. So a lot of the symptoms are similar to the flu symptoms as well. So don't ignore any symptoms. Call your provider and let your provider know if you're having any symptoms. Don't chalk it off to just allergies. Symptoms usually occur within 2 to 14 days after you had an exposure. Coronavirus can sometimes cause severe respiratory illness and have you having to go to the emergency room. Remember, I told you if you start having shortness of breath, you can't feel like you can't breathe, that's a problem. You need to go 911 at that point because you need assistance. Now, another symptom is fatigue. You know, if you can't stay awake or if you can't wake up, that's a symptom as well. So I want you to be mindful of that. Also, bluish lips or around your face. It's like a bluish purple. Sometimes with dark-skinned individuals, it's like more of a gray, ashy look. Men, please don't delay going to the doctor. Call 911 if you need help. You tend to wait to the last minute, and don't do that. So coronavirus is something you cannot play for. It's not like you get an infection and then you go later, you get a bad feeling, you get antibiotics, and you're good. This is not the same thing. So please do not wait. Please seek out medical urgent care if you need it for any other symptoms. Don't neglect yourself and try to not go to urgent care or the emergency room. You just have to let them know your symptoms, and they will probably tell you to wear a mask, or they will protect you once you get there. But do not neglect yourself, because if you ignore your medical problems, your temporary symptoms like a stroke, you could be having weakness on your right side, your mouth, not being able to talk, weakness in your arms or your legs. If you go to the emergency department in very quickly within 8 hours, then it can possibly not be a permanent symptom. So don't wait, don't hesitate. Don't make your medical symptoms worse than they need to be. Now, who's more vulnerable? Of course, we know it's people that are 65 and older, but it affects all people. So don't think you're exempt, because it's now hitting people in their 20s and in their 30s. So no one's exempt. But you're more vulnerable. It increases your risk when you're 65 and older, or if you have health conditions like heart disease, hypertension, chronic respiratory lung disease, asthma, COPD, lung sarcoidosis, everything that's impacting that lung disease, diabetes, cancer, most commonly, that does happen with these particular individuals, kidney disease. And now there's a new study that's proven that pregnant women are at risk. And a lot of times, some of the mothers will deliver babies who test positive for the coronavirus. So pregnant women, you guys are very at risk. So you want to make sure that you protect yourself, or don't go out to places if you don't have to. It can impact your baby, and some pregnant women have actually died as well as the fetus. So pregnant women, you're on the high risk as well. Children tend to get they tend to get their higher risk as well. But people with problems with autoimmune suppression, people with leukemia, with HIV, people who have recent chemotherapy, that lowers your immune as well. Also, obesity is a high risk because it's harder for your lungs to expand because of the workload that you have. It sets you up for increased disease processes like diabetes and hypertension. So you want to make sure that if you are a little overweight, start exercising, try to lose weight, get healthy. You don't want to be obese. Children have the what we call a multi-symptom inflammatory syndrome. That's what the children have. So as of April 26, 2020, a clinician in the United Kingdom, recognized the increase in healthy children, and this is similar inflammatory process, just like the Kawasaki syndrome, where you have fever, diarrhea, the kids have body rashes, extreme red swollen tongue, they have red skin on the palms of their hands, their feet, red eyes. They look like they have an eye infection, but they don't have the drainage. You know, all the dry crust, but their eyes are red and they're inflamed. Joint pain, cause of inflammation for major organs, their heart, their lung, and the systems fail, and this is how they die. So make sure you're watching all your children, all your family members, and remember, only deal with the family members that are within your home. Try not to invite other family members or friends into your home environment. Now, if you do not have a primary provider, you can call 211 and they can give you a primary provider that's close to you. If you do, say you don't have a primary provider, but you're having severe symptoms like shortness of breath, you can't breathe, you can't catch your breath, your lips are blue, then you need to go ahead in and let them know that you have these symptoms and you might have COVID and you have to be tested. They will protect you, but we don't want you to wait. You can't wait with symptoms that are severe like that with the COVID. Now, the healthcare workers, as far as testing, obviously it's the people who have the priority are the patients that are in the hospital because they need to know how to treat them. So they're going to be high priority as far as testing. The healthcare workers that work with the patients are high priority. So LA City and LA County have partnerships, and they developed and have different testing sites, multiple testing sites, more than 35 different sites across the county. Riverside has theirs as well, and the tests are always free. You can schedule your appointment. You go online and you put in your zip code, and it'll give you the publichealth.covid19 will give you the closest areas to go get testing, because you put in your zip code and boom, several locations will pop up in your particular area. And so if there happen to be same day, you may not get that lucky, but you get one very quickly, and the test results are coming back a lot faster, usually within 1 or 2 days. But please make sure that you call ahead, you get an appointment, because if you just jump in a line, you may not be able to be tested, because there's more people testing, more people are testing positive, so the lines are long, and you don't want to be left out. So remember, especially if you're having symptoms. Now, if you're having symptoms, then you need to call your primary doctor, talk to your primary doctor first. Your primary doctor said, yeah, you need to go get tested. So then you go get tested, and you find the nearest one next to you, especially if you are one of the more vulnerable population, which is over 65, and if you have the higher risk of the other diseases like hypertension, lung disease, diabetes, immune suppressive, all those other things I had told you about. Now, a lot of the different testing sites are drive-through, so you don't even have to get out of your car. And a lot of times you're not even exposed to the employees, because they're all PP'd up. They wear a lot of gear, so they're protecting you, because they're all geared up with the proper personal protective equipment, which is the PPE. Now, we as healthcare workers, we're going to get exposed more because we're working with you. We're working with the clients and the patients that may potentially have COVID or have COVID. So we're going to be exposed a little bit more. So we are a priority when it comes to the actual testing. But if you have the symptoms, then you can be tested as well. Now, it's also important that, we have all our appropriate PPE. So, that's the ongoing fight for us. And SCIU 721, our union, is helping us fight to get the proper PPE that we need. So you'll see several things. For the community, you will have like a regular face mask, right? Cloth mask. One of those, right? What's most important is that you cover your nose and your mouth. So you shouldn't have your mouth up under your nose like this. A lot of people I see wear their mask with their nose covered. It's not helping you. Cover your nose, okay? Because you're exhaling, you're inhaling. So you want to make sure your nose is covered. Now, another thing that some people are wearing, they're wearing the blue or yellow, what we call surgical masks. Some are called non-medical masks that are like these. Some of them, and they have the bridge where you can fit it across your nose as well, and that's fine. You want to make sure you keep your nose covered. Now, another thing you can get, they have what we call K95s, where you can order those. They're not like the N95, but they're K95s. It has the bridge where you can fit across your nose as well. So those you can get as well. You can order those just about anywhere. These are going to protect you about 95% of the time greater than just a regular cloth mask. Doesn't have any, it has a small percentage, but it's better. It protects the people from you. Like if you coughing and sneezing, it's going into the mask and it's not going to go out into the air. So it's more of a protection from other people. Now, another thing, there's goggles. So you're going to see us with goggles, right? There's different types of goggles. And you can order your goggles as well online. We have gloves. We have the waterproof gowns that we have to wear to cover ourselves when we go on, when we see our patients or visit their homes. So these are the things we have to have. We also have shoe covers and booties. And we also have, an N95. An N95 is for healthcare workers. We have to be fit tested. We have to be fit tested to find the right mask that fits us, to make sure that we have 95% that we will not get in that virus. So we have that, right? So we have that. So these type of masks is what you'll see the healthcare workers wearing to protect themselves from the coronavirus, because we're dealing with patients or clients that potentially have it or do have it. So we have to be protected. Okay? So that's what we wear. And then as well, we have face shields. Face shields, it covers your face, your front face here. So these are the face shields. Okay? So this is what we wear. You can order these online as well if you want the extra protection. You can do that. So those are the items that we have to wear. You can also make your own cloth mask. And all you need is a couple of stretchy bands, right? And you need just a square piece of material. This is my SEIU hanky, okay, for the union. And you can fold that in half, right? And then you take each side and fold it in half again. So you fold it coming down, right? And then you fold it coming upward. It depends on how big you want it. It depends on how the adjustment is on the particular material. And you put the rubber band or elastic band for the hair on either end, on both ends, and you fold it over. You fold it over. The cloth is folded over like so. And then you grab the bands and you put those around your ear while you hold the cloth in place. So you have a mask that you can make on your own. Okay? So that you can do with cloth. You can even do it if in emergency. You know, I've been to a doctor's office and I didn't see people with masks on, so I went and grabbed some paper towels. I did like 2 or 3 layers, did the same thing, and asked the clerk for rubber bands, right? And I put it on the either end, just like I did with the cloth. So it's no excuse why you should not be wearing a mask. You should always have a mask. Okay, see how that is? Now, these are napkins. So there's no excuse to not wear a mask. None. These are just paper towels. Okay? So everybody can wear a mask. Now, so no matter when you go out, you make sure you have your mask on. Make sure you keep in your social distancing, right? And they say 6 feet, but remember, I tell you the truth. So there's scientific proof that when you cough, the virus will travel 12 feet within 50 seconds. So I'm kind of glad that Biden and all of them are going to have the next debate like 12 feet apart, because that's much better than the 6 feet, because you're just kind of fooling yourself if you think that's good enough, because it's not. Okay, so just keep that in mind, because I'm going to always tell you the truth. So you can access the science online, where they actually have mannequins where they forcefully cough and they track how far the virus travels. And it travels at least 12 feet within 50 seconds. So that's what I wanted you to know. And that's what's important. So I want to thank Katarina Thompson. She's our fearless leader with SEIU that's helping us ongoing fight for our rights with making sure we get PPE. Now, as on the county website, as of September the 24th, there's a total of 15,391 healthcare workers that have developed the coronavirus. 15,391. Now, this is just in LA County. Can you imagine what the numbers would be if we had it across all counties and if we had it across all states? So this is just LA County. More than 15,000 healthcare workers have tested positive for the COVID. Now, there's some asymptomatic cases as well that means people do not have symptoms, but yet they have the coronavirus. And these are the ones that are super spreaders. And at first we said that was the young people, right? Because they thought they were invincible. So they don't even have symptoms, but they're spreading it around, partying and gathering up. And this is what happens, and they spread it, and then they go take it back home, or they go take it back to their school. Where you saw on some of the campuses, they had to shut them down because they went to parties, and then people tested positive for the coronavirus. So it accounts for 10% of the positive healthcare workers. 10% of us, of the total cases, are asymptomatic. So we have to really be careful and watch ourselves as well. But that's why we wear protective gear, to protect ourselves as well as others. Now, there's a total of 95 deaths in LA County. This is LA County statistics. And the majority of the healthcare workers, this includes firemen, the first responders, all the nurses, including LVNs and certified nurse aides. 50% of that group, 55% of that group is men. So men, you guys have to really pay attention to what's going on, as well as the ages range. The largest number was between 50 and 65. So these are the individuals that before the 65, this is hitting. And the largest group in that group is Hispanic and Latinos. 48% of the ones who are dying are Hispanic or Latino national origins. So be careful. Make sure you're wearing your mask. Make sure you're keeping the social distancing. When you're drinking, if people are drinking, they don't think about the social distancing. They get too close. And that's another reason why they have shut down the bars. So try to stay away from bars right now. Now, the majority of the virus, the deaths, come from the SNFs. But also the ones that are dying between 50 and 65, they have comorbidity, meaning they have diseases like we mentioned at the risk factor, diabetes, hypertension, lung disease. Those are all included in that number. But 56% come from the skilled nurse facilities. And you guys know about that. Now, The majority of the cases are 36.6 from nurses. Nurses is 36.6%, with 43.2 of the deaths, percent of the deaths. So nurses, we have to be careful. We have to protect ourselves, and this is why we fight so hard to make sure that we are protected. So please continue to wear your mask when you go out so you can help protect us as well. It has nothing to do with where you come from. It has nothing to do with your religion or if you're left wing or right wing or whatever. It doesn't matter. Wear your mask because you're all going to be exposed and probably pick it up if you don't wear your mask. So we see what happened with the president. He finally got the COVID. So wear your mask. Listen to the scientists. Listen to the scientists. No one else. Listen to the scientists. That's what they went to school for. That's what all they study. That's all they do is infectious disease. So listen to the science. Now, another new thing that's come out is eye protection. So there's eye protection because there's mucous membranes in the eye, the conjunctiva, and so you need to have eye protection because the virus, there's research that's proven that the virus has entered in through the eye. So you want to make sure that you pick up some goggles. The ones that I have, and they have to fit. They have to fit good. I order them from Amazon.com. They should be paying me for this. But anyway, you can get the kind that don't fog up, and they fit very well. You see that? They cover the side. They fit very well. They fit like shades or you're tighter than even your glasses because it has this side fit. So regular glasses or contact lenses is not eye protection. So let's not get that one twisted. It's not. So CDC has recommended this eye protection for your eyes to decrease the disease from getting into your eye so you don't contact it that way. So regular prescription glasses it doesn't cover you. Contacts, it doesn't cover you. So don't think you're okay because you're wearing glasses. Now, these particular ones do fit over your glasses. So if you have glasses, they will fit over them. So you can get the ones that say, fog free and that fit over your glasses. So you can get those particular ones. We want to make sure that you don't get those different viruses and bacteria in your eyes like herpes simplex. You can get Staphylococcus aureus, virus symptomatic infection, bloodborne viruses like hepatitis B or C. You can get HIV. You can get herpes. You can get rhinovirus infections. All of this can enter into your eye from droplets, from coughs. And we already know coronavirus is in the air. We're waiting for CDC to catch up and say that it really is airborne. We already know that. So catch up, CDC. You want to make sure that, you're watching your hands and your fingers and you're not rubbing and touching your eyes. So gargles appropriately fitted. Make sure there's different types. There's some that what is highly effective eye protection is the goggles. Now, we do have the face shields, right? So you can have the face shields on. Like if you're going to have like splatters, so it protects the rest of your face, right? But if you notice, there's room here and there's room under here. So the virus can go under the face shields. So that's why goggles are the preferred choice for eye protection, okay? If you're going to have splatters, then you need to add this as well. Dust, mist. According to the experts at 123, a vented gargle has open ports on each side of the gargle for ventilation. There's open areas. There's holes on the side of the gargles which will allow ventilation. So those are not really the best gargles that you should get. Now, if you want to, there's two different types. The non-vented gargles have no venting or any kind and offer protection from dust, mist, liquid, and vapors. Directly vented gargles may allow penetration or splashes or sprays. Therefore, immediately indirect vented or non-vented gargles, they give you the best control for its protection, right? So if you notice, like these are my glasses. So these fit over my glasses if I need them. See that? It still fits over my glasses. It protects this side right here, so I'm still protected. So if you have to wear glasses, you want to make sure you get the goggles that will fit over your glasses so that you're protected. Okay, so when you're looking it up on the internet, you have to ask for that. Now, the face shields are commonly used for infection control, and some places alternate for this versus the goggles. But for the best control when it comes to the coronavirus, you need the goggles for the eye protection. Now, if you, like I say, if you're going to be working with splash procedures, then you need both because the face shield covers the rest of your face to prevent splashes on your skin. The goggles is for your eye protection. So there's a difference. So that's what I'm trying to, reiterate to our management team is that the preferred eye protection is goggles and the appropriate fitting goggles that covers the size so it doesn't enter into your eyes. So I will continue to fight for that. And you want to make sure that when you do have a face shield that it's going to cover, it's going to be on your crown, and it's going to protect and wrap around to the points of the sides of your face. That's the appropriate face shield to use. Now they're disposable. You shouldn't be, reusing them. So you want to make sure that you have the right one. It's indirect or no vented, meaning no holes in your glasses. Okay? So those are the protect ones. Now also in the hospitals we have the elastomatic full face piece. It's like a half one. It has the big part right here with the round circles. You've seen those online. Those, or we have what we call the poppers, where you have the whole head with the hoses coming out the back with a body pack. Okay, that's all inclusive, so that covers your eyes very well. That's a whole different situation, which is perfect for eye protection for the nurses that are working in ICU with these nurses that actually has the COVID. Now, according to the Mayo Clinic COVID-19, you have to make sure you take care of your mental health as well, because people are having financial struggles, they losing their jobs, they're stressed, they don't know when this is going to be over. So they have to social distancing, and some people are social bees. They have to be around people. So this is impacting them. So as a leader, I have to make sure that you're getting the right information, because there's a lot of misinformation out there. So anyone who says don't wear a mask is wrong. You need to wear a mask, and now you need to wear goggles. So when the science says move and change, that's what you do. So now here we go. So it's the mask and the goggles that you have to wear when you leave the house. So order you some goggles. Okay, so like I said, causes stress and anxiety because of the pandemic. Nobody knows when it's going to end. Nobody, everybody's going to have some anxiety. Nobody's perfect. We're human. It's normal to be stressed. It totally ripped apart our whole life the way we normally live. And we have to take care of our brain. Our brain is what works everything else. It's just like the transmission in your car. If it's not working well, then nothing else is going to work well. So we have to take care of our brain. Now, you take care of yourself. Be mindful about this. You want to make sure you get enough sleep. Sleep is very important. So you want to get enough sleep. So if you can't sleep, you can talk to your provider about it. But you can also take a natural remedy, which is the melatonin, to help you sleep. Usually take it about an hour before you actually want to fall asleep, and then it'll help you go to sleep. So melatonin. So you want to make sure you get enough sleep. Schedule your sleep time, the same time. Try to do it every time, even if it's on the weekend, You want to try to stick to your sleep pattern. And you want to have uninterrupted sleep. Now, sometimes if your partner snores, you got to put in some earplugs. So, that's what you got to do. That's what you got to do. So get you some earplugs. Participate in regular physical activity and exercise. Exercise it helps to relieve anxiety. It's always good to move anyway, right? We're supposed to move, so you want to do that. You can include such things as dance or these different Tai Chi or different things. You can get plenty of those online. I will show you in a few minutes some exercises you can do as well. You want to make sure, though, you keep your social distancing. Now, if I was you, I would stay at least 12 feet away because of what I told you about the science, not just 6 feet. Eat healthy. Make sure you stay away from junk food. You want to make sure that on your plate, 50% of your plate is fruits and vegetables and not a bunch of pasta and rice and potatoes and all of that stuff. You want to start eating more healthy. Avoid tobacco and alcohol. Now, lung problems are already high risk for the COVID. And if you're smoking, if you're using that vaping, it's no good. Vaping, a lot of teens are even dying from those vapors. So you don't want to have nobody vaporing. You don't want anybody to die. It increases your risk for lung disease and increases your opportunity to get the COVID. So you don't want to do that. So try to stop smoking at this time. And alcohol, it tends to be a depressant. After you're drunk, you get severely depressed. So you're back where you started. Actually, you're more depressed. So a lot of people are increasing their alcohol. Stop doing that. Don't increase your alcohol. Limit the screen time. You want to at least shut down an hour and a half or so before you actually want to go to sleep. At least by 30 minutes before you want to go to sleep. No screen time. Get off the computers, your laptops. You turn off the TV, your tablets, your phone. People say, oh, I'm not doing it. But if you turn off the computer, but then you get on your phone on Facebook or Instagram or wherever you want to go, you're still doing screen time. So you want to cut that out. Decrease that at the end so you can relax. And remember, a lot of stuff you see on the internet is not true. So you have to make sure when you see things, you research it to make sure you find out, because it's not always true. Now, you want to make sure that you stay consistent. Limit the exposures to the news. If it's really causing you stress, don't watch it every day. Cut back on it. But you got to stay on top of what the CDC is saying and different sites like that, or our medical experts, our scientists. That's who we want to listen to. Our scientists, no one else. Scientists, CDC and the WHO, the World Health Organization as well. Stay busy, do some things, clean out that closet you haven't been able to clean in a while. You're at home, so think of little things to do, set small goals that you can accomplish. Don't set a big one. Oh, I'm going to clean the whole house. Well, you're not going to be able to do that all day. That's not going to happen, so set little goals. Oh, I'll just clean out this side of the closet. And then it won't add stress to you. If you have children, that's a whole nother thing. So now you have to homeschool your kids. Then you want to have break times and fun times. Sing songs, do dance alongs, sing alongs. Teach your kids how to wash their hands 20 seconds, singing Twinkle, Twinkle, Little Star. Gloria Gaynor Will Survive. Happy birthday. Get your kids ready. Get them ready to wear masks, because if they do go back to school, they need to be used to it, because you got to do it over and over at least 3 times before you get it and change into it. So just know that. So get your kids active and teach them how to wear that. There's spiritual support. You can call your minister or your religious leaders. You can call your primary. You can schedule a mental health assessment or a psychologist or a social worker. There's nothing wrong with that, so get out of that stigma. Remember, the brain is what controls everything else. Give yourself credit for when you accomplish things. No one's going to accomplish everything they want to accomplish, but if you do accomplish little things, hey, give yourself credit, because without you, it wouldn't happen. So give yourself credit. Make connections. Call your friends you used to be with. Text them. Email, give them a phone call. FaceTime them, get on Zoom, a group of friends, and do crazy stuff like you used to do. You just have to find ways to keep in communication with each other if that is what you're missing. Support from family members, call your family, how you doing? Check on them, make sure they're doing okay, especially if they have to quarantine for 14 days. That means they cannot leave their house for at least 14 days if they have exposure or if they actually had the coronavirus. So you really want to check on them when they're going through that, because that's the scariest time, and that's the most vulnerable time for them. So you want to make sure that you realize when things are not typical. When you start feeling a certain way, down and depressed and not wanting to do things, not want to bathe and take care of yourself, and this goes on for more than 3 days, then you need to start calling your doctor, because that's a problem. So if you notice your family member down and out and they're just lingering around for like 2 or 3 days, talk to them. You might want to encourage them to seek out help for that. Talk to them and encourage them to do that. Also, you need to make sure, watch them so that people are not suicidal. You can call the minister first if you want, if they're close to the minister, and then the minister can talk to them, and then maybe the minister can convince them to seek medical care from the professionals. There's also organizations like the National Alliance on Mental Illness that for substance abuse and mental health, so you can contact them on the website as well. You can also, if you're feeling like, suicidal, actually ask the questions. Do you want to kill yourself? You have to ask the question. And if they say yes, do you have a plan? Okay, if you got a plan, okay, well, what's your plan? Well, I want to shoot myself. Okay, do you have a gun? If they have a gun, then you have reason to be concerned. If they have feeling it and they have a plan, then that's a serious situation. And then you want to talk to them, or you also want to give them the National Suicide Prevention Lifeline at 800-273-8255. Again, that's 800-273-8255. That's the Suicide Prevention Lifeline. Some people just need to talk to somebody. Also, there's if they don't feel comfortable on the phone, there's a web chat, and you can talk to them at Suicide Prevention Lifeline, all together, no spaces. Suicide Prevention Lifeline.org/chat, CHAT. Again, these are all the letters together, Suicide Prevention Lifeline.org/chat. So if you don't want to talk to somebody, you can chat with them online. That it's just getting it going, the conversation going. But if they feel suicidal, then you need to take action. If someone's saying that they want to shoot themselves or stab themselves, or if they want to take pills or whatever, then that's serious when they have a plan. So I want you guys to keep this number. This is 24/7. So again, it's the Suicide Prevention Lifeline at 800-273-8255. Again, that's Suicide Prevention Lifeline at 800-273-8255. That's it won't cost you anything. It's an 800 number. Also, if they don't want to talk, they can chat online, and these words are all together, no spaces. Suicide Prevention Lifeline.org/chat. Again, all together letters, Suicide Prevention Lifeline.org/chat. So if people are feeling really bad, then you want to let them know that to take care of themselves. Also, other ways to take care of yourself is make sure you get enough to build your immune system. You want to take B complex. You want to take garlic. Is very good for that. It's for your immune building, as well as zinc is very good for that, as well as vitamin C. If you don't want to take a bunch of pills, you can get orange. Oranges are good for that. Avocados are good. Zinc. Pineapples are good for that, as well as, blackberries are very good zinc products. They're fabulous. Also, almonds and cashews, if you're a nut person, those are good for zinc as well to build your immune system. Now, to fight off help fight off the coronavirus, there's acid. Corona doesn't like acid. So you can eat the orange, the pineapples, the limes, avocados again. They don't like acid products. Mangoes. So these are the different products that you can use to help build your immune system and to help you fight the coronavirus. So you want to eat healthy, stay healthy. You want to exercise. So another thing I do is you can wash your nose out, your nasal out. So if you're out and about, and you say, well, you want to take a shower and wash up and all of that, you can also wash your nasal out. You just put a pack in there, and you fill it up to the line, warm water, and you put your nose, hold yourself over the sink, and you squirt it, and it cleans out your nasal passage. Oh, it feels so much better after you do it. So there's other things online that you can get, but this is what I have, and that can help you clean out your nasal passage. Also, you can, when you get up in the morning, make sure you gargle. Gargle is, when you brush your teeth is fine, but you want to gargle as well, because sometimes there's mucus that's sitting in the back of your throat because you're sleeping and it drains down. So when you gargle, you can gargle and get that out of your mouth, and you can spit it out. So gargling is good too. You want to make sure that you're cleaning all of your products that you bring into your house before you use them, because the coronavirus, it does stay on packages, cardboard, metal. It hangs around, so you want to clean all that off. You can get towel with antibacterial soap and lather up very good and wipe down all your packages before you put them up or open them. Now, once you finish that process, make sure you wash your hand. You can also put some bleach in the sink and some soap and water and use that to wash down your items as well. You can create your own bleach product by getting your own spray bottle and putting 1/3 of the bleach and the rest 2/3 of water into a regular bottle, and you can make your own bleach spray so you can clean down and wipe down your items instead of having all of those wipes, because those get expensive, and sometimes you run out of them. They run out of them in the store. So get you a thing of bleach, and that's another way that you can keep clean by doing that. So you want to make sure that you're taking care of the whole person. So what I want you guys to do is go online and order you some goggles for eye protection. So when you go out, you have your goggles, and you want to make sure it doesn't have a bunch of holes on the side. You don't want those vented ones. You want the ones that are non-vented, because you don't want the air going in, because you want your eyes covered from the side. And if you do have glasses, remember, you just have to get the goggles that fit over your glasses, like these. These fit over my glasses. So you can put your glasses on, and then you're still protected because you have the side parts covered, so you're still protected. So you want to make sure that you do those. And I get the kind that's fog-free. And if you did forget to get it, you can order the patches. There's individual patches that come where you can wipe on your glasses, and it helps keep them from being fogged up. So you want to make sure when you go out, you have your mask, your cloth mask, and make sure when you wear your mask, your nose is not like this. You want to make sure your nose is covered, right? Covered. And your goggles. This is what you should be wearing when you go out into the public. A mask and goggles for eye protection. Remember, face shields is not the preferred choice for eye protection. Now, if you want to add the face shield, by all means, that's up to you. You can add the face shield. You can have your goggles on for extra protection. That's up to you. But if you're thinking about just eye protection, you need the goggles. So goggles and your mask. Right? Whenever you go out, always always have a mask on. No matter, like I said, it has nothing to do with what nationality you are. It has nothing to do with what age you are. Kids that are under 2, they can't wear masks. But if they're 2 and older, they can wear masks. So start teaching your kids to wear the mask. Have them practice so they'll get used to it. Everybody should wear a mask. Everybody should wear goggles for the best protection, right? I'm going to tell you the truth, right? So you need both. You need the goggles and you need the mask. So that's what you need to do to stay safe, is to wear both. Now, the other thing, remember, it's very important to keep yourself healthy physically. So you want to build your immunes. You want to make sure you're sleeping good every night. If you don't get enough sleep, it affects your immune system. It affects your, what that means is it affects your ability to fight off infections. So you want to keep your immune system strong. And there's some new research that says that a lot of people who have severe symptoms with the COVID have weaker immune systems. So start building your immune system up. Eat healthy. Eat more fruits and vegetables. There's no reason for you not to have them now, because there's Instacart, there's even Walmart groceries. I mean, there's all kinds of things that you can order and they deliver right to your home. So there's no reason not to eat healthy. And if you have your kids, if they're overweight, don't let them drink their juice. Have them eat their fruit. So eat the fruit instead of drinking the fruit. It's healthier that way and it's less calories. So that's what's important, is that you maintain a good, healthy diet. Okay, so we're going to take a break. Okay, so next time we'll do the exercises. So I'm just going to stress the point. You can watch some of my previous shows. You can go to my website, Markeitha.com, and click on some of my previous shows, and the exercises are always at the end of the show. It's on the last show, matter of fact. So click on the last show, and you can see the exercises at the end. But what's most important nowadays, what's current, because, I'm going to keep you guys current, is that you wear a mask. Right? Wear a mask. It must be big enough to cover your nose and just over your chin, at least. And then you're going to wear the goggles. Make sure there's no holes in them on the side, because that's great eye protection. And you want to make sure that you keep that big fit well. So, wear your goggles and your mask.